Welcome to Crossing Paths, Audiology and Healthcare Conversations. I'm Max Rubin, audiologist and owner of Brooklyn Audiology. Today we have Dr. Jacqueline Jones, otolaryngologist, also known as ear, nose, and throat doctor. Dr. Jones, please tell us a little bit about your expertise and about your practice.
Max, it's so nice to have a chance to share our thoughts together. We've worked together for a couple of years, and it's great to have the opportunity to share our collaborative nature with all of our patients. So I am an associate professor of otolaryngology, as Dr. Rubin had said, ear, nose, and throat. And I see both adults and children. And I have two practices. One is in the Upper East Side of Manhattan, and the other is and Brooklyn Heights. And Max and I actually share an office, so which
Yes,
is
we
one.
do. Um, so I think it'd be really good to discuss what you add to the healthy aging process and your role in the treatment of hearing loss. So oftentimes treating hearing loss requires another team member. And for example, for patients who experience asymmetrical hearing loss or differences between the ears, can you discuss why it's very important to follow up with an ear, nose, and throat doctor?
Yeah, it is so interesting. I was talking to a patient this morning about how difficult it is to age. It's not something for the weak of heart. Getting older and accepting some of the things that we're all plagued with, and one of those is hearing loss. As we get older, everyone has some hearing loss. The question is how much it affects you. And that's where, Dr. Rubin and I work so closely together, is to improve people's quality of life. And one of the things that we're mostly concerned about is that we don't miss something that is correctable. So again, everybody gets some hearing loss as they get older. It affects some people more significantly than others. But what we don't want to miss is that hearing loss that can be corrected or that is signaling some sort of medical problem. And as Dr. Rubin was talking about, asymmetric hearing loss, meaning hearing loss that's more pronounced in one ear versus the other, is a warning sign that something other than age-related hearing loss is going on. And some of the things that we worry most about is that could be the sign of benign tumor, which is growing on the hearing nerve. And the hearing nerve is in the head, inside the brain, so we don't want that. It could also be a sign that there is chronic infection or even a tumor in the middle ear. Again, unlikely for these to be cancer, but because this is such a confined area, these growths can cause significant problems. So that's something that we want to rule out. And that's why we work together when we see signs that are worrisome.
We're all predestined to lose our hearing, but there's things that speed it up, right? And there are things that cause hearing loss that aren't so natural and need to really be remedied by someone like you, an ear, nose, and throat doctor. So important. I would also like you to discuss how you would advise a patient who wanted to treat their hearing loss through an over-the-counter device or something that's direct to consumer or retail.
Okay, I'm going to tell a personal story. My husband has hearing loss, and he absolutely refused to get hearing aids for the longest amount of time. And,
Oh,
wife, I nagged, and he ignored, until my daughter-in-law finally said, you're not hearing anything that we say. And he finally gave in. But he went once, he got the hearing aid, and they didn't go back because he didn't like it. But that's the thing. That's what happens when you get a hearing aid and you just plunk it in your ears. Fitting a hearing aid is a fine science that, Dr. Rubin is really skilled at. And this isn't a one visit. This is a visit where you have to work with an audiologist to get the hearing aid so that it works well for you, because the dropout rate from people using hearing aids, as you know, Max, it can be really high. If it's bothersome, if it's not fitted right, if it's not giving benefit. So it's really, really important that you work with a professional to get this right. Because again, if your hearing is such an important part of your cognition, and we're going to talk about this again in the future, is if you're not hearing well, you're not engaging with the world, and that can lead to significant problems as we age.
first of all, I hope that he's wearing them every day now.
It's been a week.
Well, it's so true. Treating hearing loss is not a do-it-yourself experience. I mean, it takes follow-up care and making sure that it's fitted correctly, and that we're doing the necessary testing, like real ear measurements, to ensure we're hitting prescriptive targets in someone's head. Because, like medication, if you don't give the right dosage, then you're not really addressing the problem fully. So, yeah, follow up care is so important. And also, over the counter devices, they don't support you well in background noise too. And when you're still straining in a restaurant or working so hard to hear, that can have negative impacts on not just the hearing loss, but your cognition over time. So, so important. Yeah, thank you so much for bringing that up. And thanks for joining us today. It's been a pleasure. And like Dr. Jones said, we share an office in Brooklyn Heights. She's there on Fridays, and our patients really love her.
Thank you.
And thank you again for sharing your insights. Really appreciate it.
Wonderful. Pleasure speaking to you.